Welcome to our Total Joint Replacement Program. We're very proud of the program that we have here at St. Mark's Hospital. We see a lot of patients each year, and in fact, we do approximately 900 total joint replacements each year at St. Mark's. With that comes great quality and outcomes. We know that we're providing great quality by the feedback that we receive from our patients. We also know that we are providing great quality by the certification that we have received from the Joint Commission, an accrediting body which validates the work that we do every day for our total joint program. We're so proud of that work. We're proud of our physicians, our nurses and techs and therapists and many colleagues who care for you, our patient, each day. We know that you will have a great experience here. And again, we welcome you to St. Mark's and hope that you have a great experience. Thank you.
Hi, I'm Terry and the Ortho Navigator here at St. Mark's. This presentation is to help you prepare for your total joint surgery. At St. Mark's, we take pride in taking care of you. As you prepare for your surgery, here are a few key points to remember. Your surgeon's office should give you a packet that includes the Total Joint Guidebook. The guidebook has vital information to help you facilitate your total joint replacement process. Here are a few suggestions to prepare your home. Having chairs with armrest is a good idea, as the armrest can help support you as you get out of the chair. A recliner can be too low and hard to get out of. Remove rugs or anything that you may trip on. Also, handrails will help you maneuver the stairs. It is important to prevent any chance of falls. If you have a pet, you might consider finding someone to take care of them during your healing process. Remember, you cannot drive until your surgeon okays it, which can be several weeks after your surgery. Nutrition is important. Increasing your protein intake prior to surgery will help you heal faster. An additional nutritional supplement drink can help support healing. You can prepare freezer meals prior to surgery to maintain a good, healthy nutrition after. If you are diabetic, controlling your blood glucose prior to surgery can prevent complications. A coach can be a family member, a spouse, or a friend. What does a coach do? A coach provides comfort and motivation for you. They observe the therapy sessions while in the hospital, help you to do the exercises, and overall support you through this process. We recommend you ask someone to be your coach. The shower prep is important to reduce infection. Please wash thoroughly with an antibacterial or an CHG soap as recommended by your surgeon. Do not use lotions, powders, or shave. Please sleep in fresh linen and pajamas. Prior to 5 p.m. the night before your surgery, hospital staff will call you to let you know what time to come to the hospital. If you have not heard from the staff, please give your surgeon's office a call or St. Mark's pre-op department. Do not eat anything after midnight. You can drink clear liquids up to 2 hours prior to coming to the hospital, which means any liquid you can see through. No cream in your coffee and no red dye drinks. Up next, one of our orthopedic surgeons will explain your procedure.
Hi, I'm Dr. Brent Nicholas. I'm the head of the Joint Replacement Program here at St. Mark's Hospital. Just wanted to welcome you to St. Mark's for your joint replacement. So I would like to talk to you a little bit about joint replacement, hip replacement and knee replacement in particular. So when it comes to having a joint replacement, it's good to have a plan before surgery, and that's something you'll go over with your individual surgeon. What implant to use, what approach is going to be used, and everything like that. The other thing is to have a plan after surgery, where you're going, when you're going there, how you're going to do physical therapy, whether it's home health or outpatient. Now, every patient is different, and that's something that you need to discuss with your individual surgeon. When it comes to a knee replacement, obviously you're going to be able to have a lot of questions. You're going to have those answered with your surgeon usually. But I just want to kind of explain what a knee replacement is. This is an example of a knee replacement. So once you have a knee replacement at St. Mark's Hospital, once you're in the operating room after meeting your anesthesiologist before, what you're going to do is in the operating room, we tend to favor more local anesthetic, so a spinal anesthetic, to where you're breathing on your own. You won't remember anything, don't worry, but doing a spinal anesthetic as well as a pain block. That is a combination of pain block that the anesthesiologist can do as well as the surgeon. Once you have that done, we can start our procedure. And a knee replacement, a lot of people think it's a big chunk of bone that's removed and it's a big piece of metal. That's not really the case. It's more of a resurfacing. This is just an example of an implant that is used. So the clear represents the bone here, and then the metal, more of a plastic model, but the metal here represents the implant. So you see it's not really a big piece of metal. It's more resurfacing the ends of your thigh bone or femur and shin bone, the tibia. And then there's a plastic piece in the middle. So we go through the procedure and replace the knee, and then we end up, once it's all done, we close up the knee, close up the incision, put a dressing on, and then you're off to the recovery room. Hi, I'm Dr. Brant Nicholas. I'm the head of the joint replacement program here at St. Mark's. Just wanting to welcome you to St. Mark's Hospital for your joint replacement. So I'd just like to tell you a little bit about hip and knee replacement here at St. Mark's Hospital. Obviously, before surgery, it's extremely important to ask a lot of questions to your individual surgeon and get those answered. In particular, it's good to have a plan and to know exactly what is going to be done, what approach is going to be used, what implants are going to be used, and that's going to be dependent on you and your individual surgeon. So getting those questions answered before, it's very important. Another thing to remember before hip and knee replacement is to have a plan after surgery. What that entails is when you're going to go home, whether it's same day or the next day, it's whether you're going to need physical therapy, whether you needed home health as well. All those things are important for you to ask before and understand before surgery. Once you're at the hospital, you're going to meet with your anesthesiologist, and once you're back in the operating room, what we tend to favor here at St. Mark's Hospital is more local anesthetic, meaning a spinal anesthetic. Sometimes you're not always able to get the spinal anesthetic, sometimes you need a general, and that's okay, people do well with those also. With a hip replacement, we tend to do the spinal anesthetic. There's not really a pain block that the anesthesiologist gives, but it's more something we use in surgery where we inject in the soft tissues around the hip joint. But once you get your anesthetic and we move forward with your surgery, I'd just like to show you and kind of explain a little bit about hip replacement. So this here is a model of one of the hip replacements. Now the clear here represents the bone. So this is the pelvis bone, this is the femur bone here. Okay, so a full hip replacement is where we replace both sides of the joint. So just kind of showing you this here. So this here represents the pelvis side. This is actually what the cup looks like. Okay, this is just a representation of one of the hip replacement companies that it can be used, but most look like this here, very similar. So we remove the bad arthritic bone, replace it with a socket, and then it has a plastic liner. That's usually what is used. Sometimes there's a variation. That's something you can discuss with your surgeon. On the femur side, we remove the ball and replace it with an implant as well that goes down inside, and then there's a ball. It can be ceramic, which is pink. Also, you can have a metal ball. It depends on what your surgeon prefers and what they use at the time of surgery. And then instead of bone-on-bone arthritis, which is what you have now, it's this one in particular, ceramic on plastic. So the pain that you have now is actually gone the day of surgery. But once we finish the surgery and get the nice new hip in there for you, we end up closing the incision, putting on the dressing, and then you're off to the recovery room.
Hi, my name is Tyler, and I'm a physical therapist here at St. Mark's Hospital. I'm going to show you a list of exercises that you can perform on your own prior to your surgery, because research has shown that the stronger you are going into surgery, the better your results are going to be. So if you'd like, follow along on page 32 of your booklet, and we'll go over those exercises. So these exercises should be performed every day. There's no one-size-fits-all exercise program. So depending on the joint that you're having replaced and your activity level and strength going into the surgery, you may need to modify these exercises. So whether that's leaving some of the exercises out or adding additional weight, scaling back the repetitions, however you need to modify. But the important thing is try to do them every day and build up that strength going into your surgery. So heel raises are a basic exercise where you're going to be standing. You can hold on to something secure if you need to, like a countertop, and just raising up onto your toes. You'll come up, pause, and back down. So the next exercise is a side kick. So also probably holding on to something that's secure that you can keep your balance on. This is a good exercise to work on the strength of your hip. So you're going to stand to the side and kick your leg directly out. You can also go straight back behind you to work on good hip strengthening exercises. So each of these exercises should be performed about 10 to 20 repetitions each. But as a reminder, you're going to modify and change the number of repetitions that you perform based on your ability. So the first exercise is an armchair push-up. And the reason why we do this is because you're going to need good, strong arms to support yourself as you're recovering from surgery on one of your leg joints. So the first exercise is an armchair push-up. You're going to place your arms on a nice sturdy chair or surface and basically just pick your body weight up off of the chair and come back down. So as you come up, try to have a little pause at the top and then come back down to the chair. So the next exercise is a straight leg raise, and you can perform that when you're laying down in a bed or sitting out on a couch, but your leg will be straight out in front of you and you're just lifting your leg up in the air and coming back down. Again, having a little bit of a pause at the top. If you're doing the exercise in a chair, you can also sit down and just do a march where you're lifting your knee up in the air. Same idea, you're going to have a little bit of a pause at the top to make sure that you have good control over the muscles. And then the last exercise sitting down is called the long arc quad. So you're sitting down in a chair and you're kicking your legs straight out in front of you and then bringing it back down. Again, having a little bit of pause at the top, having nice control over the motion. So we do get a lot of questions about purchasing equipment prior to your surgery, but don't worry about buying any equipment right now. We can help you determine what you're going to need while you're here in the hospital with us. That way you're not spending money on anything that's unnecessary. Good luck with your surgery, and thank you for choosing St. Mark's.